All right, so while we're here, let's use the ball and do a little self-reflexology. So it doesn't, in reflexology, we usually start with the right foot and we're just going to roll the ball around. And it's easiest, of course, to get in that middle section of the foot because that's where it fits nicely in the arch. And we have lots of reflexes in here. All to do with elimination, digestion, uh, and things like the uterus, ovaries, fallopian tubes. So a lot of reproductive stuff all in this area. If we do the heel, if we were to roll the ball on the heel, that's the pelvic area. It's a little harder to do, but worth doing. So just trying to get all the sides. So we're covering the whole heel. Inside, outside, all around your ball might move. This one is harder. Good. And then here's something to try. If you put the ball, I don't think you can quite see. I'm just going to shift my camera a little bit. So if you put the ball between the feet and then put your right foot slightly ahead. So you're getting the inside of the heel area here, but the ball's not rolling all over because the other foot is kind of keeping it in place. You're getting some more pelvic areas. And also, this is the low back reflex down here. Okay. And then you can just do a little general moving all over of the ball. If there's a place that feels, you notice it feels really sensitive for you and you want to stop there and apply a little pressure, you could do a little forward fold. If you put your elbow on that thigh, you get a little more weight. And it should be a hurts good, not an acute, I can't breathe through that kind of pain. If it feels like that, then stop and release. Let's have a few more seconds here. And then we'll release and come up. And we're not done with the ball yet, but to set it aside so you can have both feet flat and notice the different sensations in the feet. All right, now we're going to switch over and do the other foot. So we start by rolling over the whole sole of the foot as best you can. Always like to give extra attention to those digestive and elimination reflexes. And then when you're ready, you can get down into that heel. It's a little coordination practice too. Trying not to lose the ball. And we want to make sure we get the inside, the outside, all around the heel. And then we'll go ahead and put that ball between the 2 feet and use the other foot to stabilize the ball somewhat so we can get the inside pelvic reflexes and the low back. So this low back, I'm referring to coccyx sacrum. And remember, the sacrum is where that SI joint is. And then when you've had enough of that, go back and do an all over roll. If you have carpet, this is probably going to work better than non-carpet like I have, where the ball wants to roll all over the place. And then you can just set that ball to the side, let both feet be flat. Just notice if it feels like there's more surface area of the feet touching the floor, and maybe there's some tension that has released.